You know, this time of year, especially as far as sending your child out into the world, it's back to school time for a lot of parents. And are there any things that you can think of that should be on the back to school list for a parent if their child has asthma?
Well, one of the keys is to try to stay as close to infection-free as possible. Purell, real important to have, making sure things are okay, so you can keep your hands clean and prevent you getting a cold from one of your classmates. Um, Trying to make sure that you have all your medications up to date, that the school nurse, if there's one, has some of the medication available so the child can use it in case of an attack, that there's a good asthma plan that's been set up by the physician to help guide you on the treatment. Those all become important, and everyone understands what that plan is and how to look at it and how to take care of things should the attack happen. And it's also teaching the child his triggers or her triggers, teaching the child to recognize when they're getting tighter. Even though they may feel some of them, they may not associate it with being an asthma attack, or they may figure they're having so much fun, or they just want to ignore it, hoping that it goes away, and getting them to realize it doesn't go away. There are plenty of people out with asthma who do lots of things, and you just have to recognize it and keep it at bay.
Um, you know, especially with wanting to be part of the gang, part of the group. Um, One thing that we've heard from a lot of asthmatics, both adults and children, is especially with adults remembering their childhood, is, you know, the dreaded going to gym class.
Sure.
And the dread of gym class, you know, the feeling of tightness when they were in gym class, perhaps an unsympathetic gym teacher or coach.
Mhm.
Is there any advice that you can give parents and kids, you know, trying to get over that fear and also perhaps dealing with a difficult situation?
Well, we know now that there are a lot of us who are older that were not diagnosed with asthma because asthma was considered to be that extreme essence of not being able to breathe while being active. But there are a lot of us who had exercise-induced asthma, where we would cough with running or get short of breath a little bit sooner. We know now that that is asthma, and people live with asthma all day long. As a matter of fact, in the 2008 Olympic Games, there were 65 members with asthma. Some of the gold medal winners had asthma. So we know that these kids can do anything they want. But what it means is being careful. You take your asthma medicines before your physical activity. And most of the time, PE comes close enough towards recess that if you take it either immediately before you leave to school, or within a half hour or so of doing physical activity, you'll wind up being able to keep up with everybody, and in that way decrease your chances of having an attack. Teachers have to understand you need that little bit of a leeway, and so just being able to explain that to the teachers is important as well.